Welcome to the Jamaica Funk Show with KT on Spreaker.com. Well, Irie Mon. Welcome, everybody, and I'm KT, and welcome to the Jamaica Funk Show. Tonight we have a great show for you. Our guest will be Everett Foney. Everett is a specialist in Medicare and healthcare plans. You know, every year you have to change or choose, I should say, a healthcare plan that works for you and your family and your health needs. He's going to tell us about all the different things that we need to know when choosing healthcare plans and how to choose them correctly. So we have that. Then I want to talk to you about the victims of Hurricane Maria and tell you about some charities that you can contribute to outside of the Red Cross, because I understand people are having a lot of problems or a hard time dealing with contributing to the Red Cross, given the conversations that's going on out in the community. So, if you don't want to give to the Red Cross, you can give to Catholic Charities, you can give to the Salvation Army, or you can go online to GoFundMe. There are several GoFundMe charities out there, and there are phone numbers there for you to call the people, talk to them, to find out if they're legitimate, and that kind of thing, if you don't want to contribute to the Red Cross. But please contribute, because these people don't have anything and they need everything. So it's important that we do contribute to them. So guys, without any further ado, we're going to jump into some music, because we got a lot ahead of us. So I want you to grab that last piece of jerk chicken and whatever it is that you're eating and drinking, and I want you to get ready for some show enough, mama shut your mouth, reggae music. Well, Irie Mon.
When you do your little thing, step in a small ring and jump back, baby. Jay Brown's gonna do his thing. Popcorn. Yeah, yeah, yeah. Sometime I'm feeling low. Sometime I'm feeling low. I call another brother talking about Maceo. Maceo, blow your horn. I don't want no trash. Give me some popcorn. Maceo, come on. Popcorn.
Wickedness, increase, man.
From them crime. Kai kai kwenko kuf kaf kai.
Look how easy me boss your head. Waterhouse. Boy get gunshot and run and drop. Be a big everything man knock. Them receive everything man clap and chop up like chicken back.
When some boy a send friggin' shot at them grave man digging that 12 gauge sprinkle on them skin like chicken pox. Me have to say why you killing pops.
Them know me I'm a dead long time. And my friend them a tell me them for dead long time too.
Them a forgot them a fi shed long time. And me rifle shot a pop them neck like shed one time.
Grimy life man live from man a kid. And me no take no talk when no than a give. When me rifle select a one man a live. Any boy try fi run a stop on a fridge.
Kuf kaf kwenko kai kai ko. Kuf kaf kwenko kai kai ko. When me hide you them can't find you. A kuf kaf kwenko kai kai.
When police and soldier can't find you, a miller and money study binds you. Me guns them is all that I know. A cook up when go kai kai. Gunshot and run and drop. Be a big everything man knock. Them receive everything man clap and chop up like chicken back.
When some boy a send friggin' shot at them grave man digging that 12 gauge sprinkle on them skin like chicken pox. Me have to say why you killing pops. Them fi know some man a sci-fi and rolling the bus na little pie. Me say kuf kaf kwenko kai kai. The way the wickedness increase we make the poor cry.
Them say them but them tell them what's lie. Jungle is swaggy them friend a close eye. Anyone you see with the rifle close by. Boy let them coulda pray to the most high.
Kuf kaf kwenko kai kai ko. Kuf kaf kwenko kai kai ko. When me hide you them can't find you. A kuf kaf kwenko kai kai.
When police and soldier can't find you, a miller and money study binds you. Me guns them is all that I know. A kuf kaf when go kai kai. Boy get gunshot and run and drop. Be a big everything man knock. Them receive everything man clap and chop up like chicken back.
When some boy a send friggin' shot at them grave man digging that 12 gauge sprinkle on them skin like chicken pox. Me have to say why you killing pops. Them fi know some man a sci-fi and rolling the bus na little pie. Me say kuf kaf kwenko kai kai. The way the wickedness increase we make the poor cry.
Them say them but them tell them what's lie. Jungle is swaggy them friend a close eye. Anyone you see with the rifle close by. Boy let them coulda pray to the most high. Kai kwenko. Yeah, those are. What am I doing? What am I saying?
From them crime. Kai kai kwenko. Kuf kaf kai kai. Why? We kai kum. Kai kum. Kai kum. Kai kum. Kum. Kai kai.
All right, guys. So if you're just tuning in, you're listening to the Jamaica Funk Show. Tonight we have the honor of having a guest with us that's going to teach us some things about healthcare, because I know healthcare is a sore subject for a lot of us. We don't know how to go about choosing the right healthcare plan, and if you're a senior, you really are having a problem probably with Part A, Part B, Part C, Part D, and all them parts that we really don't understand. So tonight our guest is going to educate us. So without any further ado, let's bring on our guest, Mr. Everett Foney. Everett,
Yes, good evening.
how are you?
I'm doing fine.
That's good. That's good. So, Everett, can you tell our listeners a little bit about yourself and what you do and how you do it?
Yes. Well, it's an honor and pleasure to be able to speak before your audience.
Thank you.
I'm a licensed and certified insurance advisor. I'm a graduate of Dunbar Vocational High School here in Chicago. And I'm a father of two sons. And I have a college degree from the University of Wisconsin in Platteville. Attended Keller Graduate School of Management, studying marketing. Also have over 20 years experience in the engineering field with several corporate companies. I started my insurance career back in 2020, and 2004. I'm sorry, started.
I was about to say, we ain't got that far yet.
And I started selling Medicare Advantage in 2006 directly with a corporate company. Okay. I actually left that company in 2014, started my independent career, and formed an alliance with a field marketing organization, which has been a tremendous blessing. They're one of the best field marketing organizations out here in the market. And I found my company, New Benefits and Financial Services, Retired and Healthy, on the principle of educating our seniors. Because when I was out here for the past 13 years to 11 years working in the Medicare field, I saw all the different problems that our senior population was having when it comes to understanding their insurance and when it comes to understanding prescription drugs and how it works. You know, it was a big problem.
Okay, so let's jump right in. I want to ask you a couple of questions. So tell us, what are the changes in Medicare?
Well, Medicare was originally signed into law back in 1965. And 52 years later, it's basically the same in principle. Medicare Part A, Medicare Part B. Now, when it first signed into law, Part A was for hospitalization coverage, and Part B was basically for services outside of hospitals for doctors. But Medicare comes with a lot of co-insurances, deductibles, a lot of hidden costs. So along the years, they added different provisions that was designed to strengthen Medicare. They passed the Balanced Budget Act back in 1997, and that introduced the Medicare Choice Plan, where we know the Medicare Advantage Plan. They rolled out the Part D in 2003, and it took effect in 2006. And with that brought in a prescription drug plan for the Medicare. So Medicare has changed year after year. It's constantly changing. You have rising costs with deductibles. The Part B is increasing for people who are new to Medicare. Right now, it's $134 for somebody who's new to Medicare, and it's going to continue to go up over the next few years. So most of our seniors don't understand that our health care cost is rising on a continuous basis, basically because the amount of people who are now turning 65 and become eligible for Medicare, and our federal government is spending a lot of money in the healthcare pool, so they're looking at ways to cutting costs.
Well, here's something that I want to ask you. So we have the Part A, Part B, Part C, and Part D. Okay.
Yes.
And when you work for a company, you usually pay into Medicare. Okay.
That's correct.
And my question is tell us about this Part A, Part B, Part C, and why is it we still have to pay when we already paid?
Great question. Okay. You're paying because Medicare, when you have original Medicare, the Part A is for hospital. It comes with a deductible. Part B is for everything outside of hospital, but it only covers 80% of your bill. So you have a 20% that you have to pay out of pocket. But the doctor's portion of Medicare has a monthly premium. And normally it's designed where it's deducted from your Social Security. Some people monthly premiums is lower than the other ones based upon how many years they've been on Medicare. But it's always been designed where you have to pay for your Part B portion of Medicare to get doctor's coverage. So you still, if you do not pay for Part B, you will not have access to be able and privilege to go outside and get coverage for doctors and for outpatient surgery services and things of that nature. Anything that's outside of the hospital, you have to pay for that because, frankly speaking, you're going to be using those services more often than going into the hospital. So you have to pay for that. Now, Part C is the portion of Medicare where you have an option to roll into a insurance plan under a private insurance company and have your Medicare Part A and B built into it. What it does is helps you with that 20%. So normally if you roll into a Part C plan, which we call Medicare Advantage plan, you don't have to pay the deductible for hospitalizations. You do not have to pay the 20% that Medicare is not covering. So it eliminates that 20% that you have to pay, but you do have cost sharing, meaning that if you use that services, although you do not have to pay the 20% of a large unknown amount or the deductible for hospitalization, you may have a copay to go to the hospital. You may have a copay to go to the doctor. You may have a copay to go for specialists. So it's designed like that. Mm-hmm. But if most of the cases, if you enroll into a coordinated care plan, which we call our HMO plan, most of those plans are zero premium. So therefore, you can get additional insurance on top of your original Medicare without having to pay additional premium. The only drawback is you have to stay within the network. If you go outside of the network without prior authorization, the plan will not pay your bills. You have to stay within the network. You have to follow the guidelines of the network. As long as you follow the guidelines of the network, you should be fine.
So now, how do you select the right plan? Because there's so many plans out there, and most of us have no clue how to select a healthcare plan.
Okay, so let's go back to original Medicare. Now, it was never designed to be meant to be as a standalone insurance plan, per se. That's made changes along the years. As our senior population started to retire, you start to have more people turning 65 or people on Social Security disability become eligible for Medicare. So the government is spending a lot of money towards health care. So what you have to do, you have to look at your options. You have two different main options. Option one is to have original Medicare and purchase a supplement. Now, a supplement is also through a private insurance company where you pay a monthly premium anywhere from $125 to $200. It all depends on what company you're signing that contract with. You pay a monthly premium, and they pay all of your bills under Medicare. Medicare is still primary, but you have a supplement to pay in addition to the Part B. Okay, and because you have Medicare A and B, in 2006 they're saying everyone must have a Part D plan. So you still have to purchase a standalone prescription drug plan through a private insurance company to have prescription drug coverage. So if you choose option two, you're going to be paying for original Medicare Part B. You're going to be paying for a supplement. You're going to be paying for a prescription drug plan. And then, in some cases, it all depends on what type of plan you select, from a Plan F or Plan G or Plan N. You may incur some out-of-pocket expenses. the most popular plans out there are the Plan F, where basically you pay more, just like you're paying for a Cadillac or a Mercedes. You're paying more, but you get when you go to the doctor, you don't have to pay anything because you're paying the maximum amount of premium to get the top plan. So that's the first option. Your second option would be your Part C, which we call our Medicare Advantage plan. Now, the Medicare supplement, some of those plans are called Medigap plans. And most of our seniors think a supplement would be a Medicare Advantage plan, but that's not a Medicare Advantage plan. A Medigap plan means it fills in the gap where Medicare do not pay. So Medicare pays 80%, you have to pay the 20%. You purchase a Medigap plan to pay that 20 to cover that 20%. Now, your second option, which is becoming very popular, is your Part C plan. And this is a plan where you've been paying all your life, 10 years, 40 quarters, paying to Medicare taxes, which we call FICA, and a lot of that money goes into the Medicare Trust Fund. Now, with the new laws, you have these plans that's popping up that allows you to join a plan, or to enroll into a plan, and most of these Medicare Advantage plans has a zero premium. Now, it all depends on what type of plan on the Medicare Advantage you enroll into. You have different types. You have an HMO plan, you have a PPO plan, and then there's a hybrid plan or POS plan. But most of the people select the HMO plan because of zero premium. Okay, so you do not have to pay additional money on top of your Medicare to get an insurance coverage. That's your second option. And it also has built-in prescription drugs with it to meet the 2006 prescription drug rule. So that is a popular plan. Here's the thing. You do have to stay within the network. You have to select a primary care doctor. If you want to be seen by a specialist, you have to get a referral from the doctor. We call it coordinated care. Now, some of our seniors don't like to have referrals, but in most cases, a referral is good because if you get a referral, that doctor, which is your primary care doctor, who acts as your quarterback, it's between you and your primary care doctor, they will steer you to the right provider to keep you in network, to keep your out-of-pocket expenses lower. So those are your two options. So that Part C bundles Medicare Part A and B together, and it also, in most cases, has a Part D prescription drug fare built into it. And it gives you extra benefits that original Medicare and Medicare gift or supplement plans do not come with. Some plans have dental coverage.
Yeah, I was going to ask you. I was going to ask you about the supplemental, the supplements, the Medicare options.
Yes. Okay. So the Medicare Advantage plan can come with vision or dental or hearing or transportation or free health club. Most of those plans have all those added benefits to it. The Medicare supplement or Medicare Gap plan is just covering what original Medicare do not cover. They do not have the extra benefits. So you have to pay for those extra benefits. If you want to get dental, you have to pay for dental. If you want to get vision, you have to pay for vision. So when you choose a supplement, it could be very expensive. When you choose a Medicare Advantage plan, it can save you a lot of money, but you have to follow the guidelines of the network. That's the difference.
But basically, you're basically asking for a referral from your doctor, and your doctor is the one who gets to give you that referral, so it doesn't cost you anything extra if you got prior permission to see some specialist.
Yeah, you may have a small copay to be seen by a specialist, and it varies from plan to plan.
Okay.
But you can basically know and understand when I roll into this plan, you can manage your dollars because you know exactly what it's going to cost you when you go to a specialist, or pretty much if you have to go to an ER through a Medicare Advantage plan, or if you have to go to urgent care. You know exactly because it's defined in the summary of benefits of the Medicare Advantage plan.
Okay. Okay. Everett, we're going to take a quick break. So hold on, guys. We will be right back. You're listening to the Jamaica Funk Show with KT. Well, Irie Mon.
Don't worry about a thing, 'cause every little thing gonna be alright. Singing, don't worry about a thing, 'cause every little thing gonna be alright. Rise up this morning, smile with the rising sun. Three little birds pitch by my doorstep, singing sweet songs of melodies pure and true, saying, "This is my message to you." Singing, don't worry about a thing, 'cause every little thing gonna be alright. Saying, don't worry about a thing. Steer it up, little darling, steer it up. Come on, baby, come on and steer it up. Little darling, steer it up. Oh, it's been a long, long steering together since I've got you on my mind. Oh, and now you are here. I said it's okay to see what we can do, baby. Just me and you, come on and steer it up. I will say, little darling, steer it up. Come on, baby. Up a King River to wash my dread. Upon a rock, I rest my head. There I vision through the seas of oppression. Oh.
Wickedness in grace, man.
From them crime.
Kai kai kwenko kuf kaf kai.
Look how he
Yeah, been sitting here, baby. I've been waiting on you, baby. I've been keeping my cool, taking it smooth, watching all the guys manufacturing lies. Now I know it's
Hey
time.
guys, you're listening to the Jamaica Funk Show. And tonight's guest is Mr. Everett Foney. He is a specialist in healthcare and Medicare. So Everett, as we were talking during the break, tell us what about Obamacare. What does that mean, so we can understand
Okay.
it?
When you look into our healthcare system, you have different ways that people get healthcare coverage. First way, we have people who qualify for state assistance. That's called Medicaid. And basically, the state has offered those individuals fall at a certain income level insurance through the state. Then in the state of Illinois, we have what we call county care. So those are individuals whose income is just above the income level for the state requirement. So the county care offers them insurance. So if you fall at a certain level, you can qualify for county care coverage. And as long as you're not 65, you can be on county care. As soon as you turn 65, you roll over to Medicare. So that's for people who are 65 and above, and people who are receiving Social Security disability for 2 years or more, they're also eligible for Medicare. The Obamacare fits into the equation where you have individuals who's not working on a group plan. They're probably not a veteran. They probably are self-employed individuals or people who work for companies who don't offer insurance. That is where the Obamacare program comes to play. And it's based upon your income. The higher your income, the more you're going to pay into the Obamacare system. But the Obamacare system has a higher deductibles and higher copay. So the problem we have in our Obamacare system, we have a lot of insurance companies pulling out, and that risk pool for coverage become narrow. So the companies that remain can charge higher premiums and higher copays. So it is a problem in that area. So our government has to find a way to fix that. But if a person is receiving Medicare, they do not have to enroll into Obamacare because they're covered under the seniors health care plan, which is the Medicare system. So that Obamacare fills in the gap between people who are not working and not eligible for Medicare.
Okay. So now let's talk about baby boomers because we've been touching on it, but we haven't quite talked about it. Tell us how baby boomers are affecting the Medicare or healthcare system right now.
Well, it's baby boomers. We all are baby boomers. It drives what's going on in the economy.
Mm-hmm.
As they're saying from 1946 to 1964, there were basically 80 million people who were born, and they're categorized as baby boomers. Mm-hmm. Now, I had to go back and do some research, and I looked at the Forbes magazine from July 2015 and read it, and it's actually true. If you're born between that time frame, it was about 80 million people who were born, and as of the day now, it's 10,000 people turning 65 every day. Mm-hmm. Which means the baby boomers, they're retiring from the workforce and they're going into the Medicare system. And you do not have enough people who's working, paying into the Social Security system to offset the amount of people that's retiring. So therefore, that's going to drive up the cost of Medicare. Right now, the government's spending about 15% towards Medicare for our senior population, and it's going to continue to rise. So when they roll out the Affordable Health Care Act, one of the things they wanted to do was to strengthen Medicare where it will be not have a problem all the way throughout 2035. So they added some different mechanisms in place that will strengthen Medicare, such as the whole goal was to have an improved system that will keep our seniors healthy and live an active life, a longer life, a prolonged life. So you now have these coordinated care plans, which is the Medicare Advantage plan, that would come into play where they try to keep the seniors out of the hospital. They now have a lot of preventive services and screenings and tests that's basically built into our insurance plan at no cost, because they feel that if we get these early screenings and early detected, it can catch something at an earlier stage, which prevents you from going into the hospital. Mm-hmm. So the less seniors that's going into the hospital, it's less cost you have to pay into the Medicare system. Okay, you also have chronic condition plans and other programs that's designed for people who have chronic type conditions. They also phase in things for people who are taking a lot of prescription drugs. By 2020, they'll eliminate what we call the donut hole, where a person can be taking a lot of medication, and then all of a sudden they spend so much out of pocket on their medication, and they lose prescription drug coverage near the end of the year. Well, that's going to be phased out by 2020. So it was a lot of things that was added in that Medicare pool under the Affordable Health Care Act to help our seniors and strengthen Medicare. So the baby boomers is driving all of that. You don't have enough people who's working, paying into the Social Security system to offset the amount of people who are retiring from the workforce. They're taking their 401ks, so they're losing money there. Our baby boomers, so they're trying to find a way. What we're going to do with our 401ks and our pension plans. This is why you see problems with some of these organizations finding a way to pay these people who are retired because the money's not there for their pension. It's all because of the baby boomers. It's the drive for the economy.
You know, I'm a baby boomer like you, and what happened when the baby boomers were working and paying into the system? I mean, because we paid our dues, and I don't get why baby boomers should be penalized due to the fact that there are not a lot of, there are not as many people in the work arena as there were baby boomers when we were the ones that were paying for the people ahead of us, or the generations ahead of us.
Well, Catherine, let's look at this. We have, in our country, we have been in war for, 10 years or more, fighting wars, where that costs a lot of money.
Yeah, so, wars cost a lot of money, but it wasn't the baby boomers. I mean, that...
I know. But what they've been doing, and I don't want to get political.
Yeah, we won't get political, but
they borrow money from one fool to pay for something. Okay, or whatever, to avoid raising taxes. Okay, so it's all boiled down. We have our baby boom generation. They're retiring. They're in their golden years. Okay, they're retiring. They're living longer. The technology is allowing our seniors to live longer. There's things that they can do that will allow our seniors to live into their late 70s, early 80s. And the more they live, the more we have to take care of them. We have to provide health care. We have to wait for them to live substantially. And then it becomes a problem.
So basically what you're saying is that if we were dying, everything would be okay.
I didn't want to say that, but...
I mean, what the hell?
When you go back before they had the Medicare system, the average age for people living was about in their 50s and 60s.
Yeah.
Okay. They didn't have the medicine. They didn't have the healthcare system. As a matter of fact, the African Americans was dying off earlier.
Yeah, because we couldn't go see the doctor.
Yeah, because now when they implement the Medicare system, not only it was designed for people in the South, but in order for it to be passed as a federal law, they had to go against segregation, so it became an aggregate healthcare system for everybody. So that allowed our race of people to have access to healthcare because it wasn't in place before they signed this bill into law.
Well, this is just crazy. Everett, can you hold on a moment? I'm going to take a quick break so we can get some Joe's poetry in, and then we're going to come back and close out, okay?
All right.
Okay. Ladies and gentlemen, we're doing Anger Issues by Miss Johanna Bright. Well, Irie Mon.
Anger issues. I have them. Yes, I do. I can't remember when I didn't. Sometimes when you least expect it, an infinitesimal thought from a time you haven't given thought to in a long time takes advantage of a quiet time, slips in under the radar in a moment of introspection, blasting through like a tidal wave during a day at the park near the shore while you're enjoying a glass of Chardonnay with your significant other who just happens to be apologizing again. And it's there. And you really don't have a full memory of why anger is an issue. It just is. But anger is in the details. The first time I rolled my eyes in righteous indignation, my youth clouded my ability to see anything except what I wanted. My eyes rolled clean through my teens, and as time passed, as the years do, my hands made gestures clearly not measured in the least explainable. But whenever the feeling of anger arose, it became clear where the fuse started and ended. With me, externally. Hands raised in the air, fists balled into knots, my fingers splayed, pointing accusations at the offending party. But just when you think that you're going to have a time to cool down, doesn't happen. But your head, it can't stop throbbing because you really didn't realize that your eyes became shot with blood, your face contorted to a point that you can see harsh lines along your cheekbones. But the worst part was feeling your heart race like a herd of stampeding rhino or elephants, and your jaw aching because before you even said a word, you were grinding and gritting your molars so hard, it was what caused the headache in the first place. And you're gripping something balled in your hands and find it's just tissue. Time is not your friend in times like these. And you know it's best to keep your mouth shut, stay out of it. Sometimes, no matter how hard you try, you just can't.
Hi, this is KT. Did you know that the Jamaica Funk Show comes on 3 nights a week? Tuesdays, where we interview ordinary people doing extraordinary things in their life and or their community at 8:15 p.m. Central Standard Time. And Wednesdays for Black History Wednesday, where we share an extraordinary story of a person of color's life. 9:15 p.m. Central Standard Time, and on Thursdays for Reggae Dance Hall Party with a touch of soul. So listen in on Spreaker.com/Jamaica Funk Show or iHeartRadio and search Jamaica Funk Show. Well, Irie Mon.
So guys, we're back with Everett Foney, our healthcare specialist. He's been talking about healthcare and what we need to know. He's been educating us. So Everett, tell people if they want to get in touch with you, how they can get in touch with you.
Yes, they can reach us at 1-800-530-9262. Our website is retiredandhealthy.com. Anyone can go up to our website and sign up for our free newsletter. And from time to time, we'll have articles that will touch information about Medicare and anything that can learn about different changes or different ideas related to the healthcare field. Our platform is to educate. We also have an entertainment piece where we do a lot of different quizzes and interact with our senior members. We also have services, not only just Medicare, we do different plans, Medicare Advantage, Medicare Supplement, retirement plans, life insurance, and we have resource facilities that we're tied to with our partners that allow them to understand where they get services when it comes to gas, light, and housing.
We're running short on time, Everett. I just want to thank you for being on the show this evening. It has been a pleasure to have you here this evening. And guys, if you're interested in finding out more about Everett and his initiative, just go to his website. So, as in parting, we're not anything without you. So without you, there is no Jamaica.
Was a cute baby when your man say not dry. No boy can't say you casual. As usual, give them phone number. You no carry me a tea, that a dirty class. So if a your man she want, she no fit her. Stretch her hand when you a pass, make you chop it her. If you in a Versace shot, start your pop it her. She in a dirty shot, tell her, take it her. So push it her. To how you take Magdalene to her. When you shop in a Jamaica, you shop a man of her. And legally, she can't shop in a very bar. You know beg for the hot girl. You was a